Welcome to the Rhode Island Division of Developmental Disabilities Quarterly DD Community Forum, Wednesday, February 9th, 2022. Hosted by advocates in Action, Rhode Island. Nothing about us without us.
Welcome everyone to the Quarterly DD Community Forum. My name is Michelle White. I'm from Advocates in Action, and we're really excited to be hosting this forum for the Division of Developmental Disability, which is the hardest thing to say. It's such a tongue twister. So I'm gonna hand it over to the director, Kevin Savage, and I'm gonna put you up here for everybody to see, Kevin. There we go. Spotlight you.
Hello, everyone. I'd like to thank all the stakeholders, and particularly adults with disabilities and family members, for attending today. It is great to see everybody. Well, actually, I can't see everybody, but it's great that you're here. We appreciate you attending. And I hope today is informative. I will remind you, if you haven't attended before, that the reason that we're here is to hear from you. A number of people sent in questions. I've tried to incorporate your questions into our presentation today. But if we don't, please feel free to ask those questions and we'll do our best to answer them or get the answers to you as quickly as we can after the meeting. We have, I think, an hour and a half for the meeting today. I'm going to go through the agenda and leave as much time as we can to answer questions from the community, which is always our goal, and that seems to have worked out very well for the past few meetings. So I'm going to start with updates, and I'll give as many as I can. I'll call on members of our team and members of the panel to give updates in their particular areas of expertise. We're going to start with the consent decree. For those people who aren't aware of what the consent decree is, it's a lawsuit that came about in 2014 from the U.S. Department of Justice to ensure that adults with disabilities receive the same treatment as everybody else. It was determined that Rhode Island was in violation of that, and we're working to come in compliance by 2024. So we're a little over, close to 7 years into it now, and we're working to meet those standards. So I'll give you an update on what's going on. There was a contempt hearing. We were not found in contempt, but we did agree with the Department of Justice and the court monitor to an action plan. And there were three main things that came out of the action plan. One was a transition fund that has a number of phases. Phase one of the transition fund was to get out $4 million to support the DDOs, the developmental disability organizations that are licensed by the state to provide services to adults with disabilities. Applications went out for those providers to apply for services to work in stabilizing and recruiting workers for their workforce. There is a workforce shortage. Some of that is due to COVID, but the reality is that the system was heading toward a workforce, I would say, crisis even before COVID, and it was certainly exacerbated during the pandemic. We did get the applications out on December 31st. Providers responded very quickly. Of our 34 providers, 29 providers requested money to work with the state in the process of that workforce recruitment and retention process, and awards were issued. I can't remember what date, but in January. And we made the request. We agreed that we would get the funding out in a lump sum. That request went to Gainwell last Friday, and we're working on getting the funding from Gainwell. By the way, is our Medicaid contractor. So they actually work with our Medicaid agency to get funding out. We worked with them. We made the request for the Medicaid provider to get the funding to the providers who were awarded the $4 million in grants. And that should be happening very quickly. We're looking forward to all the provider agencies who have agreed to work on that process to get that funding and begin phase one of this transition process. We're excited about that. Providers have expressed a lot of excitement about that. And I think the fact that 29 of 34 providers wanted to participate in that is really exciting. And we're very, very thrilled to be able to work with them in the process. Phase two of that funding, applications will be going out on that next week, and there'll be a longer period of response that will be going to a wider group of people who can offer services to adults with disabilities. We'll have more specifics on that. People will certainly be able to see the application, and we'll get that out, I believe, by the end of the week. And there are some legal technicalities that we have to work out before that goes out. But the goal is in the second process to expand beyond the workforce issues to get into real programmatic innovations. And so moving from building the workforce into programmatic innovations in the second phase, which will be a $6 million grant to the entities that can demonstrate that they can meet the innovations that are being requested in the application process and eventually the award process going forward. That will be phase two. There'll also be $2 million coming forward to support people who self-direct to get funding in the self-directing process to build the kind of supports that can help people who self-direct to network and get the kind of supports that can help people self-direct kind of access and build the kind of access to training and supports that don't exist now or do exist now in pockets, but to really formulate that into a more central way of accessing supports that might be available in other models that exist. If anyone wants to add to that, I'm certainly willing to surrender the floor for a little bit if anyone wants to add to the self-directing piece. Okay. We'll have time later for people to add, and we're going to revisit self-directing a little bit later. Heather, did you want to talk a little bit about the technology piece? This is Heather Mincy.
Hi, yes, Kevin. So the technology fund, I just wanted to let people know, one, that there is a technology fund. There's $2 million in that is specifically dedicated for individuals who are in the adult D system to acquire technology. So some type of software or hardware that will help them attain goals that they currently have in their plan or something that they think they might want to add to their plan. There was a technology acquisition stakeholder group formed in the beginning of December, and we met throughout the month of December, and we will continue to meet. But the purpose for this group was to really talk about how we are going to get information disseminated out to people around the technology fund. And so two of the things that we've done and are just in the final stages of finalizing is to put together a 2-page flyer that really gives some examples of what technology can assist people with, and also just provides them with, some other additional information about technology. And then we also put together some additional guidance too that we'd like to share with individuals. We talked about how we would, get the requests, how we would be dispersing the money. But one of the most important things I think we are discussing with this group and will continue to discuss is how we as a system incorporate technology into all the things that we're doing and make it accessible to the people who are in the system, as well as training, because we know that, people get technology, but if you don't know how to use it, if your staff don't know how to show you how to use it, or they don't know how to use it either, then it's not really of any value. So those are some of the ongoing discussions we're having regarding this. Like I said, the flyer and the guidance should be finalized very soon. Once we have that 2-page flyer done, we'll be mailing it out to everyone. We'll also be putting it on our website. We'll be sharing it with our stakeholder groups so they can disseminate it out to their groups. And we are going to have a forum. We don't have a date for that forum yet, but we will as soon as we have the information finalized, because we just want to make sure that people get the information in the mail so that they have that. And then again, we were going to have this technology forum. At that forum, we'll have an expert that we've been working with who's actually part of our tech acquisition stakeholder group, Jennifer White, who can speak to some information and answer some questions for people too. So that's where we're at with the technology fund.
Great, thanks, Heather. Next is the rate review or rate methodology process that has been a process that went out for RFP. That's a request for proposal that's managed through the Division of Purchases for the state. That proposal went out. The bid was won by Health Management Associations, and that is the organization that acquired Burns and Associate, who did a different process, a similar process back in 2011, might have gone into 2012. And there was a lot of controversy over that process back in 2011. I think that as we kind of reviewed the process, there was some stress and controversy over how the state implemented the process. And I think as we unpack it, I don't believe it's how the process was conducted by the vendor as much as how it was implemented later on. We've had a number of meetings with Health Management Association. They don't have anyone working on the new process that worked on the old one, I think just to help the process move forward with a little less controversy, but they did win the bid in accordance with all of the rules of the Division of Purchases. And we worked very closely with the division to make sure that the bidding process was fair and equitable and ethical, and it certainly was. They will gladly and are planning to meet with all the stakeholders that will be involved in being interviewed and working on the process as they present their work plan within the next few weeks. And that will be set up. Most of you or anyone who wants to be involved in that will certainly be included at meeting levels. Anybody who directly participates at the provider or advocate or stakeholder level will certainly be invited to and encouraged to participate in meetings with the vendor, and they will be happy to answer questions as we go forward. I will participate with them in those meetings as well. We've had a couple of meetings with them initially. They've been very positive. If anyone tuned into the court hearing last week, they also participated and gave an overview of what their proposal is to the court, and that also went, I think, very, very well. I just wanted to update you on where we are with that. If you have any questions, I'll certainly entertain those as we move into the question and answer phase. As far as caseload estimating process, that's a process that is new to BHDDH and the Division of Developmental Disabilities, but that's a process where we work with the Office of Budget and Management and the legislature to identify what our budgetary needs are based on caseload estimating. It's a very technical process, but we are going into our second phase of that in May, and we are beginning the planning process. We have hired 2 full-time positions to assist us in that process, and one has been working on that on a temporary basis, but will be starting full-time next week, but has already certainly been contributing a significant amount to assisting us in preparing for that process. We'll be working with the Office of Management and Budget in terms of meeting beginning next week. And we had a sort of what we called caseload light last time, just in terms of an introduction to the process. but we will be fully participating in the caseload processing at the May meeting, and we'll be a full participant under all of the Medicaid requirements that are included in participating in caseload estimating. And we're excited to have two people who will be helping us. They are not new to the process. So the people that have been hired are experienced in caseload estimating, and we're very excited to have those people coming on board who don't have to go through a very lengthy training process. That's really technical, but because there's been a lot of talk about bringing people on board to do that, I wanted to let you know about that. Next on our agenda is, I hope I'm using the same agenda that people put up, but the one I have in front of me is an update from the Sherlock Center from Amy.
So hi, everybody. My name is Amy Grattan. I'm the Executive Director of the Sherlock Center, if I haven't met you already. And I've been asked to talk about the National Core Indicator Survey project that we're getting ready to launch. The National Core Indicator Survey is a survey that is used across the states to assess the quality and outcomes of developmental disability services provided to individuals with IDD and their families. The survey addresses key areas, including employment, rights, service planning, community inclusion, choice, and health and safety. This year, our sample has 650 individuals who have been selected to participate in the survey. And please know that your participation is completely voluntary. The Sherlock Center project team will be reaching out to let you know that you've been selected. You may have been asked to participate in this survey before, maybe even last year, and it's okay for you to participate again. In fact, we really want you to participate, and we encourage you to participate because your voice and your experience matters, and it's an opportunity for us to hear your thoughts and feelings about your services. You may, if you're a family member, you may support a family member who, because of their communication style or their level of support that they may need, that you might wonder whether or not they should participate. And of course, they can and they should participate. Their experience matters as well. You as a family member are able to support them to complete the survey, and you would be known as what's called a proxy respondent. So just a couple of things on what to expect. Should you be an individual who's been selected to participate, this year we will once again provide the option so that you can do the survey in person or by Zoom. And the Sherlock Center will provide HIPAA compliant Zoom platform in order to ensure the privacy of all individuals who are participating. If you are selected, please know that the survey will take approximately 1 to 2 hours to complete. If you are self-directing your services, one of our surveyors will be calling you directly to coordinate your participation. And if your services are coordinated through a developmental disability provider agency, they will help to facilitate your participation, including the scheduling of the survey with our interviewers. We want you to have a successful experience. We want you to have the opportunity to share, again, your experiences. And so individuals who would like to participate by Zoom should have access to the internet, a webcam, and access to email or a text where the interview link can be sent to you. Proxy respondents and family members, interpreters, and other support staff can be invited if you choose to have them support you or if you need them to support you. And they will be provided a separate invitation to the Zoom if the interview is not held in person. Please know that confidentiality is important to us. Your answers to the survey questions are stored separately from your name. Your participation in the survey has no impact on your funding or the services you receive, and again, is voluntary. Please know that the Sherlock Center will not share your name or any personal information with anyone. So if you're in, likewise, at the same time, we are also looking for individuals who are interested in becoming an NCI interviewer. We will be providing interviewer training, and people are welcome to apply. And when I get done, I will make sure that I put in our new contact, Del Marie Riviera. I'll put in her email address if you would like some more information about that. So the next piece I wanted to share with you about, and what I've been asked to talk about, is our vaccine project that is happening here at the Sherlock Center, along with our partners in the Developmental Disabilities Network, which include the DD Council and Rhode Island Disability Law Center. We were provided some funds to support the education of individuals with developmental disabilities about the COVID vaccine. In Rhode Island, we worked together to create a plan which would allow us to develop some plain language materials that provide information about getting the vaccine, what it means to have the vaccine, and the importance of vaccines. Part of our plan was also to support individuals who would like to get the vaccine in order to register for the vaccine or a booster shot. And so we're offering our assistance for those folks who would like us to help them to register to get a vaccine or a booster. And so this includes whether or not you're interested in getting a vaccine or a booster in a community vaccine site, such as a pharmacy or a locally run state clinic. But this also includes supporting people to register to get a vaccine or a booster in their home. So if you're someone who would be interested in that or has difficulty accessing the community clinics and you want to get the vaccine, we're here to help. And we will certainly help register that. And we will be working with an ambulance company to ensure you're able to receive that vaccine in the home. A couple of notes about that. Please know that the individuals who will be supporting that registration process will be, they will ensure that any information is confidential, but they're also willing to assist you in registering not only yourself for that vaccine or booster, but if there's another family member or somebody who works with you, they will also help to make sure that those people are registered and are able to get an appointment. The third thing that we're doing with this project is that we are looking at our data and understanding what to understand what the need is out there, and we will consider doing some drive-through clinics across the state, particularly in light of children being able to now also very soon get the vaccine. So we want to make sure it's as easy as possible for those people who would like to get the vaccine to have access and be able to get that vaccine. So what to expect as it relates to this project and getting information about how to get help registering. We will be in the next week doing a mailing to those individuals who are receiving services. And in that mailing, you'll get a postcard. And on that postcard, there will be information about a new website that has been created. And there, if you choose to go to that website, you will get information in plain language, again, about the vaccine, about the importance of getting vaccines. There's a storybook, a social story about getting the vaccines. And there's also going to be a way to request support in order to help get to be registered for that vaccine or booster. Additionally, that postcard will give you the opportunity to fill out your name and contact information. And there will be a self-addressed stamped envelope there so that if you want us to just give you a call, maybe you're not going to be using technology, but would rather fill out that postcard and send it back to the Sherlock Center, that's another way that you can request getting the support for registering for a vaccine and or to access the at-home vaccine registration and process. And so we're really excited about these two projects happening. And so thank you for your attention. And with that, I will send it back over to Kevin.
Thanks, Amy. Appreciate it. I'm just gonna skip COVID for now and ask Brenda to give us an update on conflict-free case management.
Sure. Hi, this is Brenda Duhamel. I'm an associate director here within DD, working on the conflict-free case management project. So for those of you who might not be aware, conflict-free case management is basically a federal Medicaid requirement for home and community-based services for plan development to be conflict-free. So done by an individual or a group that has no bias. That's essentially what it means. So we are working on with the larger long-term services and support system to figure out how we will do this in Rhode Island. A group of stakeholders, a group of DD stakeholders have come together and put together a framework about how this might work here in Rhode Island, and that's been shared with our Medicaid partners. We have received some technical assistance from a group called New Additions to work through that plan and to go through and determine whether that would be compliant with Medicaid rules. And we are also receiving some technical assistance from an organization called Guidehouse via a contract with EOHHS on how to operationalize that plan. So we've been working, meeting very regularly on how to go about doing that. We are in the middle of creating a work plan and working on mapping out the current state and how we do things now and how we might do things in the future in a way to be compliant with the rules. We are hoping to be able to work with stakeholders again to share our work plan and what we've done thus far, what sort of the feedback from New Additions is on the framework that was designed by the stakeholders. They are still working through that plan. And so we're hoping that we will be able to come back to our group soon and sort of share what some of the next steps might be.
Okay, thank you, Brenda. Employment from Tracy Cunningham.
Hi, everybody. A little update on employment for you. I'm going to report back on last quarter. That's all the information that we have and we can see. To date, we have 63 individuals enrolled in our PSEP 3 project. And currently, to date, we have 9 folks who have secured employment and 9 other individuals engaging in internships. For those of you who may or may not know, PSEP 3 is going to be coming to an end June 30th of this year. So we have about 4 months left. Also in the PSEP project, we have had 46 staff trained in the ACRE customized employment training, and 8 additional staff have been certified in a mentor platform. And that's just another level of expertise in which they got technical training from Griffin Hammis Associates. So that's exciting news. Last quarter, not necessarily PSEP, but the employment outcomes for last quarter, which I'm reporting on, is October through December. 24 individuals secured employment, being supported by 6 providers. As you know, we have a hard time collecting information and employment outcomes on folks who self-direct. But the good news is, as I reported out last forum, if you remember, we are starting to acquire and catalog the ICE forms and have the ability to enter that information through the ICE forms into Therap. So a shout out to Jay McKay for doing that work. The last quarter, Jay was able to enter 156 individuals in 23 different jobs. We really want to celebrate employment outcomes. So for those of you who are securing jobs, if you just want to give us a call and let us know that you're working, or an email, we can put that information into TheraP. And just for understanding what that means is it just gives us information for individuals who are working. So we can report those great outcomes to the court monitor and the reports that we often do. And so when I give these report outs, we can include you in on that. Jay and I will pop our email addresses in here so that you can feel free to send us an email. You don't have to, the ICE form is necessary so that we can see and log that information. But just to celebrate your employment, if you want to give us a call or an email, we'll be happy to have conversation with you and hear more about it. And certainly at the end, if anybody has any questions, we'll be available for them.
Okay, thanks, Tracy. Now, there was a question on RICLAS and the status of RICLAS. RICLAS stands for the Rhode Island Community Living and Supports Program. It's the state-run residential program. There was a lot of discussion in the past of RICLAS being closed. That has been taken off the state's agenda, and it will remain open. That's being currently run by Associate Director Erin Perrin. She was not able to join us today. But I did want people to know that RICLAS will remain open as a residential program for the state. And it recently has accepted 3 new referrals. They have 3 people, I believe they've received residential homes in the RICLAS community. I think those have taken place. There's one more person who has been accepted into the program and is awaiting placement there. I'm happy to entertain more questions. I don't think that people wanted a lot of information on RICLAS other than to know that it is still in operation and the plan is for that to continue into the foreseeable future. Heather's going to give us now an update on self-directed programming.
Thanks, Kevin. So I just wanted to let people know that we do have a self-directed stakeholder group, and we were meeting monthly throughout the last summer into winter of the last calendar year, but now we've gone to quarterly. Our next meeting is, I believe, 3rd week in March. And I also think that I saw somewhere, I think there was a question regarding how many people are now self-directing their services. So I believe the last numbers that we have were 958, which is a lot. We've seen a really big rise in the number of individuals who are self-directing their services throughout this public health emergency. It has grown significantly, I think, for a number of reasons. People just, trying to find staff, but also because now parents and legal guardians can be paid as well, too. And I just want to let people know that we will, continue to work with Medicaid on continuing, for it to be allowable for guardians and parents to continue as paid employers. And that's pretty much all the updates that I have.
Okay, thanks, Heather.
Well, you know what? Actually, Kevin, I just wanted to mention one more thing. Sorry. Kevin was talking earlier about the self-direct fund. I just wanted to let people know that the stakeholder group that's meeting, some of the, the things that we talk about within that group, the challenges that people sometimes face within self-directing, those will be the main areas that we will be looking to address with some of that funding. So I just wanted to make that known too, that recommendations that have come out of that group will be the things that we're trying to work on and use that funding to address some of those main concerns.
Thanks.
Thanks, Kevin.
Okay, and then Sue Hayward's going to update us on transition to adult services.
Thanks, Kevin. I'm Susan Hayward, the Administrator of Transition Services at, DDD. So since the last community forum over the past 3 months, we've continued our work with the Transition Work Group, which is comprised of representatives from the Department of Education, Office of Rehabilitative Services, various school districts, and several adult service providers, focusing on the last 2 years before school exit. Most recently, we've had a transition panel of educators and adult service providers who've worked creatively together on transition planning, share their practices with colleagues and other professionals to help broaden thinking around transition options and collaboration. There can be a tendency to think of transition as taking place over 1 or 2 years, last years of school-funded services. However, the transition years are actually between the ages of 14 and 22. And we're rethinking how we collaborate with RIDE, ORS, and RIPEN in regard to how we share information and resources at ever younger ages, especially as we think about the foundational skills needed to make social connections, participate in community events, and build career paths. So we have ongoing communication with those entities as to the significant impact that self-determination skill development has on whole life planning and decision-making as an adult, and how we can support young adults to develop these skills during the transition years. It's challenging as a parent to conceptualize how to move from the structure of a school day and the comprehensive supports received through a school district to adult service, where you are creating a different structure as to how you spend your day, how you invite people into your life who share your interests, and how you go about accessing the support you need. So together with RIDE, educators, and RIPEN will be setting up opportunities for parents and caregivers who've been through the transition process to talk with other parents who are in that process right now. And we're also setting up opportunities for students and parents in the last 2 years of school-funded services to meet virtually with representatives from adult service agencies to learn more about adult service and share their thoughts about what is needed. As always, we're very open to input as to how to improve our communication and transition processes. And I'll put my email in the chat should anyone like to reach out to me.
Thank you, Sue. Appreciate that. I'm going to just read through some policy updates, and then I really want to move quickly to your questions. But I just wanted to get out some reminders because I know that people want to know where we're going. One of the questions that I had regarding policy is just where are we going, and what really the division is focusing on as the future comes up is, in terms of vision, is going to be this constant increasing of access to community services and supports and employment services and supports, and the increase of independence for adults with disabilities. Sue had mentioned transitioning from youth programs to adult programs, but also in thinking about transition throughout someone's life. I think I heard Sue mention the term whole life kind of concepts. We want to think of transitions throughout someone's life as they're in the DD system, from the time they transition from youth into the adult program throughout their lives, and maintaining or increasing their independence throughout the entire course of their lives. And that's really what we want to be thinking about in DD services, always maintaining or increasing independence throughout the life process as they're receiving DD services to the degree that people want and are able to do that. So that's just one of the visions that I want people to think about as we're thinking about services that we're going to be implementing and models that we're going to be implementing and providers that we're going to be working with, and even how in self-direct programming, how we want to be supporting that, increasing and developing someone's ability to be as independent as they want to be. Other things that Heather mentioned this, but there are parents who and caregivers who have been able to provide day and support services through the pandemic. There have been questions about us continuing that, and the answer is yes, we are continuing to support that process. Certainly with the pandemic, we, as many industries, are continuing to see staff shortages. I talked to you a little bit about how the transformation fund process is working with the provider community and the self-directing community to increase access to direct support professional staff. But what I wanted you to know is that we've tried to fill that gap in other ways of supporting employment and access to funding other people to provide services to adults with disabilities. We will continue to do that even as we work toward rebuilding the workforce to support adults with disabilities. There's been a big change in how we handle the appeals process. If you disagree with your funding, we had a rather difficult appeals process. I believe we've streamlined it significantly so that you can express your disagreement through an administrative process that doesn't require legal offices to be involved. It gets, the turnaround time is 15 business days rather than a months-long process that was occurring before. It's working very efficiently, and I wanted people to know that. And we'll work with you quickly to get an answer, hopefully one that's positive for you. If we do need to go to a formal appeal, which you can do directly if you want to, but I believe this process really is supporting a quick turnaround, will assist you in getting your appeal filed quickly. But I wanted you to know that is in place. That certainly came out of the administrative work groups process that many of you participated in. I am going to get a formal summary of where we are in the administrative work groups. I know we haven't met in a while. That's because we've really entered the implementation phase. You've given so much input into how we've gotten from where we were when the court order came out in July of 2020 to where we are now, that we're working with the court to identify where we are in terms of implementation, what can be implemented by the March 31st deadline for kind of wrapping up where the groups are, or what needs to be moved into another phase. So I will get that information out. I really want to thank the people who have been involved in those groups. Your work has changed the system dramatically, helped us out enormously, and I'll get a summary to you and then let you know what's been achieved, what we still need to achieve, and what continues to be worked on. But thank you all very much for your participation. I think that's all that I have for updates. And what I'm going to do now is open the floor to questions and answers for the remaining about 45 minutes of time. Thanks.
Does the technology fund help if you're interested in getting a Chromebook?
I'm going to let Heather answer all technology questions.
Okay, sorry, trying to get off mute. Can you repeat that, Deb? Was it a
Question is, does the technology fund assist you in purchasing a Chromebook?
So my answer to that would be, what would you be using the Chromebook for? Is the functionality of that? How is it going to assist you in things that are goals of yours? Those are some of the things we would need to know in order to approve it, because as I stated previously, it really needs to be something that's going to help you with some of the goals that you have and that are addressed in your ISP plan or that you choose to write in.
You know my question, right?
Does
it pay for internet? You know it's my question. I just have to ask.
Yes. Okay. So it does not pay for internet services. I'm sorry. I know people ask a lot, but I do mention, and I think Deb and both Kim Einloff have put in the chat a few times during different meetings on the broadband system that the federal government is working on so that people can have access to the internet who may not be able to typically afford it. So there are low cost or no cost programs that the federal government is working on to try to assist with that. But Medicaid does not pay for internet. For these
Just
devices.
so people know that anytime there's links like that in the video, we'll put all the links in the video. They were in it in the last time with that. It's in that video, and we'll put all that information and all the stuff that's going in chat. So if you miss it, you'll be able to get it in the recording.
Okay. And I think Kim I saw something come up from Kim Einloff too, saying that she was going to look for the link and try to put it in here. So thank you very much, Kim. Appreciate that. And Kim's one of our stakeholders on our tech acquisition group. So shout out to her.
Does technology cover upgrades to your home, vehicle, or business for entrepreneurs?
To your vehicle?
It says, yeah, does technology cover upgrades to your home, vehicle, or business for entrepreneurs? So I don't know. That means get a lift in your car or something.
I would say no, it does not. Not for something like that. But if there are certain things that people are looking for, they could use possibly their own self-directed funds, but I can't say a blanket yes. I would have to know, or we would have to know what they're looking to do and how it would be used. But specifically for the technology fund, one thing that I should mention, and our stakeholder group did discuss this thoroughly, is, do we say people have a set amount? We didn't really want to say there was a set amount of funding, but I will, to give people an idea, there's 4 million in this technology fund, and there's over 4,000 people in the system. And so it has to be able to reach everybody. And we're trying to, cast the widest net, get all this information out there. So when you do the math, it does come out to around, possibly like $500 a person. That's not to say that every single person is going to be looking at a device that costs that much. Some people may want something a little more, but I just want to give that idea, just because people asked about home modifications or modifications to their vehicle and stuff like that. There are limited funds. One of the things that the Support Monitor stressed, and we do have in some of our information, and we'll talk more probably about the guidance. It's 2 million. Thank you, Ariana. Oh my goodness, I'm saying 4 million. I'm thinking about the transition fund. So thank you very much for that correction. People probably weren't able to do my math either. They're like, that's not adding up, Heather. So it's $2 million. My apologies. But it really is to obtain some type of general technology that people can just be up and using quickly to help them within their within their lives. Some of the technology that some of us now already are using on a fairly consistent basis. So I just want to point that out.
If people could put your questions in the question and answers instead of chat, that might help us not miss some of them. But either way, we're looking to catch them. And the ones related to technology so far, if to utilize augmented equipment software, you need updated hardware, like a laptop. Could that be covered, assuming communication is one of your goals?
Yes, it could. They would have to fill out, so we're developing a form that people will have to fill out to say what they would like to purchase, how that is connected to a goal, again, within their ISP. So, and then those will come, those forms will need to come into the state. We'll have a contact person, but some of the more specifics of that, we will get into during the technology forum too, just so that people know that as well.
This is for the NCI, is the survey for people with disabilities or workers, family members, and everyone involved in the state disability services. So it's like, is it just for people with disabilities, or is it for workers, family members, and everyone involved in the DD system? The NCI
So I'll
survey.
take this one. The NCI survey is targeted at collecting information from the individuals who are receiving the services. So if you're an individual with a developmental disability and you're receiving services from BHDDH, we want to hear about your experiences and the services that you get. And so that's who the survey is targeted for.
How do people initiate the informal conflict resolution process and or the formal appeals process? Is there a format or contact person to do that?
Yeah, so that really should be very easy. There doesn't have to be a particular way to initiate a conflict resolution, and it depends on what conflict you're resolving. But if you're resolving an issue between yourself and a decision made by the state, you can do that almost any way you choose. You can contact your caseworker, you can send an email to the department. Once you let us know that you have a conflict, it enters the conflict resolution process. It's easy on you. The goal for the state, the goal for the division is to solve the conflict with you. It doesn't require a particular form to initiate the process. Once you identify that there is a conflict, we'll work with you to resolve it. So I don't want to complicate it by informing you you have to do particular things to initiate conflict resolution. You need to inform us in some way that there's a conflict. Documenting it's always a good idea. So sending an email to the person that you're working with, copying the supervisor is not a bad idea. So those are suggestions, but those aren't requirements. You need to notify us in some way that you have a conflict that you want resolved. It can be, an email is usually good because that documents it. It certainly could happen by phone call and we could initiate the process if that's your best way to communicate with us. But the issue is to let us know and we'll work on that. Emailing or some formal way that documents it is the best way. If you have a conflict, by the way, with your agency, that's a grievance. That's actually covered in our regulations. But you should try to resolve grievances with the service providers through their policies. So every service provider has a policy for how to resolve a grievance between you and the service deliverer. If you're not satisfied with service deliverers, that's a different type of conflict resolution. If you're not satisfied with how your conflict between you, the individual with disabilities, and the deliverer of the services being resolved, you can escalate that to the department, and we will work with your service provider and you to try to come to a resolution.
Kevin, we had a forum last week with Tracy and Jane. They were talking about some different things and related to that. And just to repeat, they said you could use your community, your social worker, your caseworker to help you do that. Like if you had something with your agency, because some people, so that they feel like they have somebody who could help them
Can help
talk to
them
their
navigate
agency.
that. Great.
About the technology again, somebody wants to know if they could use it for a keyboard. They mean a musical keyboard would be used for community integrated music classes. So if they wanted to be in the community and take a music class, could they use it to buy a keyboard?
So I think I'm going to just give a standard answer because I think Heather's answered rather than answer each technicality. Heather's answer, and Heather, I don't mean to speak for you, but I just want to help people understand we don't need to answer 100 questions on what you can buy. Your request for technology should match what's in your ISP. I think that's the formula you should consider, and then talk to your caseworker about your request.
Yes.
And I think that
I
generally
did wanna point
answers
out-
whether you can get a keyboard or
A laptop,
Chrome
yeah.
or whatever. There's so many different types of technology. You don't have to ask us about every single technology. Think about how the technology is meeting your service needs in your ISP, and then make the request to your caseworker or through that form that Heather discussed. It can all sound like a good idea. No one's going to approve a personal request over this call.
Yes, exactly. Thank you, Kevin.
Yeah.
I went back to look at something through the chat because I answered a bunch of different questions that were coming through on technology. And I didn't realize that somebody was asking for the home mods for entrepreneurs. So I'm assuming for their business. So you cannot use your HCBS funding, which is, your Medicaid funding that you get through the state for your business ventures. I just want people to know that because that is clear. It can be used for support services that you need to help meet some goals, but it can't be used for business purposes. Even though people are looking to get employment, you can get it, use your funding for employment supports and certain other types of things. But again, I do stress that point because I know people have asked before about using funding for business-related expenses. And again, it's Medicaid funding for your support services and other things that will help you be integrated into the community, which we know employment is one of them. But with businesses, you really, it draws a different type of line. So I just want to to point that out and say that to people.
The DD Council, just as a side note, they have a business class, a small business class that people who wanted to do that might be interested in, because they could help you find funding for stuff like that, I think.
Yes,
I mean, you
they
know,
do.
in Jen does a big general thing, but you might contact them for that. For questions about Medicare, Medicaid insurance coverage, what is the best source of information? Caseworkers not familiar, but had no suggestion about who to call. Concerned specifically about request to authorize Benelink as authorized contact, BENELYNK.
Is it behavioral health link? Is
It says B, capital BENE, capital LYNK.
I don't think we're familiar with that,
not
but
familiar
let me
with
just
that,
start with the
yes.
first part of that question, which is for your Medicaid, Medicare coverage and where to start. Generally, your caseworker is where to start. So let me ask Brenda Duhamel, who oversees that part of the division, to just help people kind of navigate where to go when you have those kind of questions.
If you're asking about, waiver question, I think those would go directly to your social caseworker. So your social caseworker is your sort of one point of contact. So you can really ask them anything and they will help direct you and get you the information that you need.
So when the caseworker doesn't know, what I think we can agree to, Brenda, is in your next meeting with your all staff caseworkers, just a little coaching that if they don't know the answer, what they need to do is tell the person, they'll get back to them with the answer and not leave them hanging without the answer if that's what happened. Likely that they have done that, but we'll certainly follow up with the caseworkers to remind them that their role is, if they don't know it, to get back to people with the answer.
Yes, absolutely.
And so we'll certainly remind them of that if there have been circumstances where people just said they didn't know and then left it at that. Hopefully that's not what happened, but I don't know. I wasn't on the call. But we'll remind people that when they don't know, their role is to follow up and get back to the person who was calling.
Absolutely.
Claire also just put in the chat that for health insurance issues, Ripon Call Center can be a great source of assistance. May not be able to solve everything, but they have been helpful for many. And the number, which will be in the recording, is 401-270-0101. Are more residential living options in the works? Shared living is not a good fit for certain individuals like my loved one. He can be aggressive, self-injurious, and destructive.
That's a timely question because we have a hearing on that very thing this evening with the legislature. So what we're working on is certainly, I won't say that we're planning on opening a whole bunch of group homes because that would not be true. But one of the things that I've asked people to do on my teams is, particularly as we're preparing youth in transition, is we know a long time in advance when people are coming out of the DCYF system, when they're coming. So Sue had mentioned that the transition process is 14 to 22. We want to work really hard, particularly on the youth who are going to be more difficult to find residential services for, to be ready for them sooner rather than later. And so we're going to work at kind of building in the process to be ready for them well before their 21st birthday. Now, the department has jurisdiction over them until they're 21. So I can't say we're going to place them sooner than 21 because that really has a lot to do with the family court and when the court wants to move them, when they're ready to move. And so we have to be careful about that from a legal point of view. But I want us to be ready so that we're not having youth who become adults at age 21 without a placement. And we have a few of those remaining, those youth. So we want to be more than prepared and placements ready to go prior to youth turning 21 and entering the adult system. Other cases that we have are people who are in hospitals, and we want step-down programs ready for those. And we have to build that capacity and be there to do that. So we're going to talk a little bit about that tonight. Lastly, though, there are still some people who prefer group homes. And one of the things that we're moving toward is two groups of people. One, if you're already in a group home, it's hard to say you have to just move. That's been your home for a long time. But the other issue is if you don't qualify for a group home initially, you shouldn't just go to a group home because that's a preference. That's actually a criteria that you become eligible for by a level of need. And so we have to make sure that people, as we talk about things like increasing people's access to independence, that you actually qualify for a level of need, and that it really is the level of need you're qualifying for. And if you have the ability to achieve independence in different settings rather than something like a group home that really sometimes is not necessarily the individual's desire, but the family needs to really work with us in finding other settings that aren't as restrictive level of care as a group home. We need to work harder at working with the whole group of people involved in making that decision with the individual involved. And we're going to work harder at that when that's appropriate. I do recognize, whoever asked that question, that supported living isn't for everybody. The goal isn't to push the wrong level of care on people. It's to right size so that everyone's getting the correct level of supports that meets their ability to achieve independence. So it's not pushing one level of care over another. For me, it's certainly not a budget exercise. It's an independence exercise that helps people achieve their goals and their levels of independence. And
So
if that opened up a lot of questions, I'm happy to answer them.
So this person asked two questions. One was, what about the older individuals over 25 for residential? My son has been on a wait list for 4 years for residential. I've been told by social worker he would have to try shared living first. I'm not going to set him up for failure in shared living.
Yeah, she should call me, 462-0581. I'm happy to take a look at that case. We're not setting people up to fail, that is for sure. So we don't have this, it's not like your prescription plan with your pharmacy that you have to fail at 3 drugs before you actually get the one that works. That's not what we're trying to do with individuals with disabilities. So we don't have that kind of plan.
Alternative residential needs are also there for adults currently living with their families. Sometimes behavioral or health issues become more than families can deal with. This might be long past transition age or only transition from hospital, or parents who are aging.
I'm just sort of kind of nodding my head. I get it. I understand that that's the case. We have to do some estate planning, some family planning, some long-term planning, and looking into the future and what do we need to have in place. And that's really individual. I'm leery of throwing out blanket statements on that. The whole system is based on person-centeredness, right? If I issued blanket statements, I would be very general in how I looked at things. And what we want to do is have very person-centered conversations with individuals and individual families about what comes next and what we need to talk about.
John Souza has raised his hand, and I know he's been doing stuff with residential. But there's another question that was there first, and it's, has there been any more information about having a staffing pool service for self-directed services?
So I was just going to say that was one of the top concerns that we've discussed within that stakeholder group. So yes, that would be absolutely something that we were looking at with those transformation funds that are dedicated to self-directing.
Do you want us to turn on John's camera?
Yes.
Michelle, can you do that, Michelle? I think this, as she's doing that, those might be all the questions so far, but if people asked a question and it was slipped through, could you just type it into the chat or raise your hand if you're not able to type it, and we can have you ask it. Are you coming, John?
So he should be here.
You're on mute, John, just so you know.
Thank you so much. I'm really happy to see that you're doing signing for people. I'm one of those very few people who can't really use this Zoom very well because I can't see. So, but anyway, I figured I'd raise my hand long enough. I just have two comments. One is I want to reinforce what Kevin is saying, is that we have done a lot of looking around the country, and I can tell you that there's probably nobody who has not been able to figure out a way to help people, even with the most intensive support needs, to live in the right place. However, it is necessary that it be personalized and individualized from top to bottom. So it takes time, it takes patience, and it takes flexibility. And I think that's what I'm hearing from Kevin and other people who are concerned about this. I think the other point that I wanted to make is that, yes, there are some people who are actually, for all kinds of reasons, more comfortable and maybe better supported living at home as long as they can. And for those people, we ought to make sure that that also happens. And who determines when they can not is going to have to be an individualized decision based on them, their family, and the support that's being provided. Once you reach a point where you can't provide enough support and the person or their family are in crisis and there are no more solutions, then you need to move to something else. But the problem is that too often nobody finds out about this until the day of or the week of the crisis has occurred. If we could only learn about the crisis earlier, I think everybody who thinks about this stuff could jump in and help and work on it. We at Plan are working on doing that. We're looking at resurrecting some ideas from the past that will help us identify people who are likely to be in that group. It's not a big group, it's not hundreds of people, but it might be a dozen or two or three. And that's a lot of people in crisis all the time. I think everyone has to be patient and everybody needs to start planning. And by everybody, I really mean we parents and our children. We should not, this is a personal opinion, I'm not reflecting the state's view on this, but we should not as parents think that, oh, it's their problem. It's not really their problem, it's our problem. It's a family problem. These are our children and we care about them from the time they're born until the time we're gone. And I've never met parents who say, well, the clock's run out, he's 21, I'm done with him, you take him. That never happens, at least I've never heard it happen. So I hope that helps a little. I had another comment from back about insurance. Can I really encourage people to contact the different insurance providers in the state? They all provide some kind of Medicaid, Medicare mixed plan. They're all different. And I can tell you from, again, personal family experience, I got two pretty significantly disabled boys who are both Medicare and Medicaid eligible. And one has a program from one provider and the other one has a program from another provider because the programs are slightly different. And I'm sure we believe that social workers walk on water, at least some of us do, but they don't know all the answers. The answers are better obtained from the actual insurance providers. And if you're looking for insurance information, go to them. Neighborhood Health, and the other one, I blanked on their name, Blue Cross, all of them provide a combination Medicare, Medicaid kind of coverage, but they're all different.
Thank you, John. Much appreciated.
We got to figure out a way for me to raise my hand a few times so you can see that You got to turn my voice on at least.
So John, just technical. It's because you weren't a panelist. So when we saw it, we were going to make you. Now you're a panelist. So now if you raise your hand again, but you're gonna want to mute yourself, or it'll keep when you make noise, it'll pop up to you.
Yeah. I'm gonna mute myself.
From Sue Bateman, who just back to the whole question about can you use your funding to do things like for your car or whatever for business. I think Tennessee's waiver does allow for funding for business related expenses. So we should look at their language in the waiver. That's just so you know. Does CMS recognize using technology for remote support, or does the department?
CMS does recognize remote supports. It's, there are a few states who are doing it, not many, but there's more and more coming on board. It's some, national discussions going on about remote supports. And it is not something that's written into our state's waiver, but it is something that is on the agenda to be discussed and for us to get it into our waiver.
The chat, Kim Einlet's put this in the chat. This is what you were referring to, Kevin. I'm going to put it up here for a minute so people can see. This is for paying for internet. It's called the, I don't know what it's called here. Helping Households Connect. If you go to this website, and this will be in the recording, but Kim Einlet shared this. It's fcc.gov/ACP/, and it's got a form. You can just apply and it'll help you get, if you need help with your funding for your internet, because the Medicaid doesn't cover it. You can go to this site, and again, we'll have that in the recording.
The way you said it, Deb, they should make that a jingle, FCC/,
yeah, whatever it was, ACC/something. Youth and transition is confusing term on its own. If we are able to make the youth aware of the type of adult services and the differences between who they are and how they may operate, so they feel more comfortable transitioning, so they can understand what kinds of services may be suitable for them, as opposed to the agency caseworker or parent working on it for them. So it's more of a comment, I think, or sign of a kind of a request of just making the information more accessible for the students themselves. I think that's what it is, Denise. If that was not it, then type something else. Or if you want to explain it more, let us know if that was right. That was from Denise Flynn.
Okay.
I'm just going to let
So
Susan Hayward just comment on that a little bit.
She is, but she can't, she's having some technical difficulties, so she can't unmute. So she let me know so that then if there were any questions. So I can say that Sue is always trying to be mindful of that and always working on updating our materials, whenever she gets any feedback from, stakeholders, whether it be, teachers, students, families, whoever, she's always looking to update and revise the transition materials or add to them. So I'm sure she will take that comment and think about that.
Can I ask a related question that we were talking about at some meeting recently? Was the types of services, like I know there's stuff on the site about self-directed, there's like a info sheet or a bulletin, but I didn't see one. I thought there was supposed to be one there about so maybe I'm not looking in the right place, about just for people to know, like the types of services, like explained. Is that there yet, or is that something that's still in the works?
I don't believe it is there, but it is coming very, very soon. Part of the work that needs to be completed for the March 31st deadline. It will be out and posted on the website.
So I just unmuted myself. This is John. I don't want to be a bomb thrower here, but I am going to say that the biggest problem with transition is, in my view, is the fact that there's too much segregation in school. When I think about what we think about here in this group, we're always talking about membership, inclusion, normalization. We're talking about helping people be part of their community. However, when with children with the same kinds of disabilities who we're preparing to do this are in school, they're mostly segregated. They're mostly helped become more and more dependent, not independent. So if we could, at the state level, come to a recognition that if we could promote more inclusion in school, we will have more capable young adults who will be capable of working, of living more independently, of being part of the community. It's not your problem, Kevin, other than.
No, it's all our problem, right? So
Exactly.
So we'll share that together, and I'll just ask Susan, she meets with the school department on a regular basis, to share that input was given at our meeting and
Great.
make sure that message is spread. Thanks, John.
No, you're welcome.
Another question. This is for Tracy or Jay. You said PSEP 3 wraps up in June. What are options and plans after that?
So PSEP 3, the third iteration, obviously is coming to an end. So we have not internally discussed what if there will be a PSEP 4.
Well, I can share a little bit.
Okay.
Go ahead.
The funding stayed in place, so there will be employment money dedicated to employment. I can pretty confidently say it won't be PSEP, but it will be funding for employment. And I can also, if Tracy stays with us and puts up with us longer, she'll be leading the charge.
So that's all the questions I can see in the chat or the question and answers. Anyone else have a question?
Well, thanks, everybody. That was
great.
A lot of great questions, and we really appreciate your participation in the forum. We look forward to getting together with you in the next quarter, which will be warmer weather again. That's exciting, how quickly the time goes by. So thank you very much. Thanks for your input, John. We appreciate that. But thanks, everybody, for your participation. And thank you to everybody on the panel for your input as well. Appreciate it.
Contact the Division of Developmental Disabilities at phone 401-462-3421, email bhddh.askdd@bhddh.ri.gov. Watch this recording again and find out more about the topics that were discussed at www.bhddh.ri.gov Developmental Disabilities or advocatesinaction.org. Don't forget, the person in the center is you. Produced by Advocates in Action, Rhode Island, 2022.